Good morning, everyone. Welcome to the webinar from Museum Development Northwest, Museum Development Yorkshire, Museum Development Northeast. So I'm Alex Bird from Museum Development Northwest, sorry. Welcome to the reopening webinar focused on inclusive practice post-lockdown. The webinar is a final one in a series hosted by museum development teams from across the north. And we have just over 40 people on the call this morning from the north of England and beyond. We are joined by Becky Morris from the Disability Collaborative Network and Sarah Simcoe from EMBED. And this 90-minute webinar will focus on new reopening recommendations and actions produced by DCN, EMBED and the University of East Anglia for all sectors, including museums and heritage organisations. These recommendations are aimed at supporting the changing needs of your diverse visitors, those visitors that are still shielding and require digital support, as well as common factors which will affect the visitor experience in museums such as signage, navigation, interpretation and customer service. I'm the chair and we have other MD staff from across the north behind the scenes that are assisting with the tech and also able to help questions in the chat by sharing links and further resources. We are also joined by Joanne from Stage Text, who is providing live subtitles for you. To see these subtitles, click on the closed captions button at the bottom of the screen. You are all muted and your cameras switched off, and please remain this way throughout the session. To improve your experience during this session, there are a few things you can do. On the bottom of your screen is a control panel where you will find the chat function. If you click on the chat, a window should pop up on the right-hand side, and you can enter your questions and comments here. Once you type in what you want to say, you can press your return key to send the text to everyone on the call. Please use this throughout the session to post questions, comments, but also to share your experiences and top tips. Please keep your comments and questions as concise and clear as possible, and note that we are not using the raise a hand function today. As there are so many of us in the session, you may find it best to switch your viewing option to speaker view so that the host and speaker who have their video switched on appear on the main screen. To do this, simply go to the top right of your screen and click on the dots you see there. When you hover over the dots, it should pop up with either speaker view or gallery view. Speaker view is the best option. If you click on participants on the control panel and find yourself, you have the option to rename yourself if your name doesn't appear in full. This will help us to reconcile the delegate list and also let others know who is in the call. The session is being recorded and will be edited before being made available online with subtitles. This is so we can share it more widely with the sector. We will also have a transcript of what appears in the chat, which will help us to respond to any unanswered questions once the session is finished and help shape future sessions we develop. I'll now hand over to Becky and Sarah to start the session.
Morning, everybody. I hope everybody's okay today. And it is a beautiful day in Warwickshire at this moment. I will just get my screen up. Just bear with me. There we are, sorted. Right. Hello, I'm Becky Morris. I'm the director of DCN and I'm an associate consultant for EMBED. DCN is an organisation which is about inclusive practice, intersectional inclusive practice in the service provision, working practice and workforce in the heritage sector. We've been running now for about 5 years. We started out as a website of resources and standards in relation to decision making for inclusive practice within the sector and the representation of changing people's needs, but also of disabled and neurodivergent people within the sector, both as visitors and workers. But we've always said that we would talk to other sectors in how they do things. And as part of that, we have now joined EMBED as a cross-sector consortium to develop and create intersectional inclusive practice within the sector through supporting people like all of you in creating this yourselves by giving you guidance that's reflected in your organisations. It's reflective of your budget And also we like to tell you what you're doing well and how we can support you in getting it right first time. So I'm joined today by the fantastic and extremely experienced Sarah Simcoe. Sarah, would you like to introduce yourself?
I'll take that introduction. Good morning, everyone. Thanks so much for joining us this morning, and thanks so much for inviting me along. My name's Sarah Simcoe. I'm director at DMS Wirral Limited, and we are a consultancy organisation that focuses in on helping organisations of all shapes and sizes transform as part of an accessible and inclusive organisation and cultural journey. And DMS Wirral Limited also founded EMBED. EMBED is a consortium that I created and founded about a year ago now, and it is made up of experts from across sectors that gives us in excess of around 30 years experience when it comes to equality, diversity and inclusion, with leanings and expertise in all of the protected characteristics, including direct lived experiences. And we're supporting sectors out there in terms of increasing their level of collaboration, in helping them to learn lessons from each of those sectors, to tap in to those 30 years of experience from the consultants that we've brought together, and then also to help us shape what it feels like to be part of underrepresented groups out there right now. And the visitor experience and the customer experience is really at the forefront of everyone's mind. So I'm absolutely delighted to be partnering with DCN as we look at heritage, and we're going to be spanning other areas of cultural sectors. So thanks, I'm really excited for the conversation.
I am too. So in relation to this is off the back of some recent guidance that we've issued called the Reopening Recommendations Support Service. This is a live document and it is there for you as a free resource, which is being updated. It's consistent to current government guidance and also in our understanding and research of COVID. That is through our partners, the University of East Anglia. And what we've done is that this particular document helps you identify what barriers that you have as you reopen. And these barriers are consistent in respect to people with disabilities and also neurodiversity. Another thing as well is that what we are seeing is there's been some interesting public messaging out there in respect to reopening at the moment, and also in terms of what is now the new normal. And what I mean by that is, can we have face-to-face meetings? Well, if you've got somebody who's being shielded at the moment, a face-to-face meeting will increase anxiety and concern. So what we're going to do today as well is just emphasize those key areas to ensure that you feel confident in your planning, but also that you're aware of some of the anxieties and difficulties that people are having at the moment in regards to being able to go out and what that means for them. So we'll get cracking. I'm looking forward to this. It's going to be good. Excellent. So one of the things that we're going to cover today, because we've got 90 minutes, but this is quite a broad subject. We're going to be looking at reopening your museum and the key considerations. We're also going to be looking at intersectional inclusion. And how can this be in terms of the planning in your post-lockdown world? We'll also be looking at what you can do as an organisation and to understand and support the needs of the visitor. And also, you need to think about your own in respect to your workforce needs, particularly now as people may be coming out of shielding. They may have a chronic health condition. They may have a problem in respect to their own concerns with their families. So we're going to be looking at that as well. We're also going to be looking at building your confidence in respect to inclusive practice, and also what does that mean to your communities, your audiences as well. So here we go. We're also going to have a little break so you can get your cups of tea in. Literally, that will be, I think, at about 10:50, we'll have a small 5-minute break. So when you're planning to reopen, the first thing you need to think about is your communication, and the different types of communication are going to be a critical tool in how you amplify and market your organization's messages to your audiences. You need to be clear, though, from the lockdown period of how many museums didn't adhere to inclusive practice when it came to communicating to their audiences whilst they were closed. So one of the things that we saw a lot was the lack of captions, audio description. Really think about your content and make sure that one of the things that we're advising you to do is create a good solid foundation in respect to digital communications. So if anything happens, you've got that as a resource. If you rush it, you're going to have to put it back on. You're going to have to put the inclusive practice on it. The problem is with that is that that creates more work. So get it right in the first place, and then you've got that as a resource. A thing that we need to consider is to ask yourself and provide on your website are things like does your shop window, your website and social media channels reflect inclusive practice to attract that audience? What information are you sending out to your users and non-users? Will it be useful and helpful to decide to visit your website? Is your organisation easy to find? Is there local directions? Are you near anywhere in respect to planning the day out? What do you look like in terms of your building? Where are the nearest toilets? What's the situation in getting something to eat? Consider how that's part of the holistic experience. And also, are there any costs to the visit that maybe contactless payment? Will cash be accepted? Sarah, I've been thinking that digital communication is absolutely critical right now to reduce the anxiety that people have been experiencing during the lockdown, and also to cut through a lot of the vagueness that's happened as well, that it's actually the organisation needs to be quite direct in how they're going to offer their services, aren't they? What do you think is the key takeaway in respect to digital information? Because we've been supporting a lot of organisations with this, haven't we?
Yeah, I mean, there was, there's always organisations that want to check on their digital accessibility anyway, but during the period of time, the strange and tragic times we find ourselves in, that's increased even more, because the need to ensure that the digital experience is accessible and inclusive. I think people are understanding the criticality of having that in place. You know, we've had the pleasure of working with lots of museums and galleries and exhibition centres and lots of visitor attractions. And the one thing that I encourage people to consider and view this piece of work as is that your website is your additional location. So when you look through that lens, when you consider it to be another museum or another art gallery or another exhibition centre, when you consider it in that way, I think it then helps you to consider the digital journey of your visitors when they go to your website and all of your wonderful digital content. So I would say the big takeaway is to consider it as an additional location and to treat it in the way you would a physical built space and environment. And I think also what we're noticing from a digital perspective is during the lockdown period, there are so many more people that are reaching into sectors and reaching into experiences that previously they wouldn't have done. We're trying to find new ways of, keeping our children entertained, and we're trying to fill the time when we've been in lockdown, and long may that continue. But I think in order for that to continue, that digital inclusion element, when we're considering that visitor experience, is also going to be important to ensure we're maintaining those lessons that we've learned.
That's the critical thing, because just to give a little bit more about this, in fact, we'll go on to this one. We know from the recent ALVA recovery statistics that there's still a lack of confidence. No matter how sort of high they go, there is still anxiety around key elements such as toilets, and also in terms of how the toilet facilities will be managed. One thing we are seeing a lot of is the one in, one out situation in respect to toilet management. The only problem is with that is that there are conditions that people have where they will not be able to queue, they will not be able to wait because they've had a health condition for which that may not be able to be managed for them. So are they going to face embarrassment by having to wait, or is it better to go somewhere else that have taken on their needs more considerately in respect to their visitor experience? There's also things like menopause, endometriosis, people that have small children, people who are elderly for which waiting for a toilet is not an option. So really think about your messages in respect to toilets and how they'll be managed. Also, don't forget your changing places toilet provision in regards to supporting the 250,000 people who can't use an accessible toilet. Also consider the contrast of your toilet and the grab rails as well. Does the wall and the grab rail, are they the same colour or a similar colour? So you find yourself in a situation where you may need a pot of paint so people can identify the wall and the grab rail, so it's less touching in respect to that. Are you going to be having opportunities for people to refill water bottles, or are you accepting reusable cups in respect to the environment? Do people need to bring their own headphones? What's the situation in respect to this? Have there been any changes in respect to parking, the building, navigating your way around the building? Would you think about creating a toilet map so people could find their nearest toilet if they need to wash their hands? Another thing as well is that we're seeing people on social media, museums in this case, stating things like, you will not be allowed to have entry unless you're wearing a mask. You cannot if you're not wearing a mask, you will not have entry. You've got to be really clear on your messaging in respect to this, because you are already causing an issue in respect to that. What happens if you can't wear a mask? What is the situation in regards to how you're going to manage that? Are you going to go up to a person and say, why aren't you wearing a mask? Where does that position your front of house staff? There are badges, there's lanyards, there are cards that people are being encouraged to carry if they're not able to wear a mask. And that means children under the age of 11 and some chronic health conditions and disabilities. But you need to really consider how you're managing that in your public messaging, and also in respect to your staff and your situation as well. So just bear those in mind, and also be very clear on how you produce those messages as well, because if you say it's mandatory, people won't go to you if they can't wear a mask, if they can't wear a mask. Right, sorted. What we also know is that because Sarah and I work together and we work across sectors, one of the things that, and with DCN has always gone to see how the corporate sector does things and the charity sectors and local authorities do things in respect to access and inclusion. And one of the things that we do is we notice trends in what we can do in terms of our survival as a sector, but also what we can learn from each other in terms of collaborating. And one of the key elements from COVID that we've noted is that the post-lockdown world will be based on flexible approaches that the organisation does to meet the needs of their customers and their audiences. So this is about navigating an issue that we may have for quite some time, and how you navigate that. We're going to tell you how to do it, aren't we, Sarah? We're going to tell them how they're going to do this. And we're also going to be looking at the adaptability, when I can say it, to support key business function and that relationship between the customer and the visitor. So it's about being flexible, being adaptable, being reflective of what's going on, creating that base of knowledge and those resources, so you have got some confidence in navigating all of this, but also creating flexible approaches. So you're more about building on capacity, but also prioritizing on what you need to do in order to maintain your organization's profile and its delivery. Sorted. Right. Intersectional inclusion's a really key one at the moment, Sarah, isn't it? In terms of multiple identities and also how people are, yeah.
It is, and I think it's important that when we're talking about accessibility and we're talking about inclusion, we're extending that out beyond disability. Disability is absolutely critical that we ensure accessibility and inclusion, but that also spans other protected characteristics as well. And I think right now, where we find ourselves as organisations are trying to reopen and we're trying to learn the lessons, that intersectional inclusive practice is going to be really important, because when you've got visitors appearing at your locations, they're going to have different identities. They could be disabled, they may be a carer of a child. There's going to be lots of different elements of the people that are coming to site. So yeah, an intersectional inclusion approach is going to be really important.
This is the key thing with intersectional inclusion, absolutely, because what we've also found is through our research and through collaboration and just talking to people, that intersectional inclusion is going to be how you navigate around this situation right now. So that will be literally the idea that we are multiple identities, and also that we have a situation as well that intersectionality doesn't look at holistic experiences. So it's not, as I would call, a cookie cutter approach. This is what people who are dyslexic experience. This is for people who have epilepsy experience. It's more than that. It's about actually creating, changing, understanding, changing needs as you get older, if you have certain conditions, and also disabilities and neurodiversity. But also it's how that experience is shaped through, if you're a person of colour, if you have, if you're from a social and economics, what your social and economic status is, and also in terms of your location, where you are within the country and in the world as well. And all of those things will actually really influence that experience. And there are people who have been disproportionately challenged in respect to COVID. We know that people of colour have experienced so many deaths. We also know that 2/3 of the COVID deaths are actually people who are disabled as well. What we also know as well, that there are key factors such as housing, occupation, earning ability, and access to education, which increase your risk in respect to COVID. And that is really important to bear in mind, particularly in regards to your audiences and thinking about how you would operate your services within the locality of your organisations, but also in terms of, are there situations with regards to things like digital exclusion as well? So with digital exclusion, there are 1 in 5 children, which is 250 per school, who cannot have access to a tablet, a phone, or a laptop because they can't afford it. And these are families as well, where people have lost their businesses, they've lost their jobs. So it's something that you want to consider, to think about your website, think about inclusion and accessibility, but also where is the situation with this in regards to digital exclusion? What is the situation in respect to your audiences? Are you talking to the local authority about this? There are a number of charities that are doing some key work in this area. And there's also been the recent report by DCMS in regards to what they're going to do in terms of their commitment to sorting out this incredible social inequalities right now. So it's really key to keep that in mind as well. Right. Another thing that we need to hit upon is that some museums as well are saying if somebody's got a ambulant mobility difficulty, that they can use the lift, and also in terms of using the escalator, things like that. How do you know? How do you know somebody has got a disability such as an ambulant mobility? You don't. 80% of disabilities are actually hidden. So what you need to do is be clear in your communication of what your offer is. You don't necessarily have to ask somebody what their disability is, and it's not appropriate to. So consider your planning in regards to the lift. Ensure that not everybody with an ambulant mobility uses a stick or a crutch. Consider in terms of intersectional inclusion, how many people could be elderly and may need to sit down, and also the situation in regards to what your seating looks like. So really think about the information that you have, but the information that you need to find out in how you can actually plan ahead in regards to your reopening information, and also how impactful that can be in respect to that. And another key thing as well, this is in regards to people who may have had COVID and are now in a process of recovery. So they need to feel as though, is there somewhere to sit? Are they going to feel tired? All the kind of recovery experiences that they're having right now. So they may want to just watch something on a YouTube channel. This is where your digital comes in as well. Right. Okie doke. And then there's the legislation side. So with regard to your legislation, this is extremely important, because if you're central and local government funded, you should reach WCAG 2.1 AA for your website under the public sector bodies website and mobile applications number 2 accessibility regulations 2018. You have got a deadline for September of this year to make sure it meets it. What you need to do as well is to consider where you are as part of your strategic plan of what your digital will look like and what it is. What have you got? So you've also got the section 20 and 29 of the Equality Act. Now the key thing is with that is about provision of services, so you do not discriminate or exclude protective characteristics, groups of people, communities and things like that. With regard to that, you've also got the Human Rights Commission and also the UN Human Rights, the right to culture. So in terms of your legislation and your strategic plan, in regards to that, you really need to think about, with your AA standard, the best bit about AA standard is that a lot of it's to do with contrast, captioning, alt text on images, links are live. There's things like Browse Aloud and Recite Me that are text-to-speech software for websites that can support you. There is stacks of templates and support, and EMBED can also offer a digital website audit. So if you're not sure about where you are, you can also ask us to support you. We can help you with that. Another thing that we need to consider as well is if you use any YouTube channels, if you've got anything such as a HLF project, which is a website-based community offer, that needs to meet AA standard too. It's a key element to have on board, and it's a key shop window which will support so many people and so many audiences, but most importantly, it will support your profile as well. I think, Sarah, with the website accessibility law, it's been a really good opportunity for organisations to really assess where they are in terms of their website and in terms of that delivery as well, isn't it?
Yeah, it has been. And it has been. And I think what it's identified is lots of areas for improvement. I think it's also helped organisations to see what they're doing really well. I think sometimes we forget to stop and recognise the stuff that we're doing great. So in that respect, it's definitely identified both. And I would say, don't forget your content. So if you're considering the compliance of your website, absolutely right. You've got to do it to those standards around the accessibility and the legislation that's been passed. But also don't forget your content. You may have a really great accessible website and then we've forgotten about the actual content, documents, flyers, whatever the case may be, but also make sure what you're learning through that accessibility assessment is running through into your material as well.
That's the key thing, because it's one of those where this is all joined up, isn't it, when it comes down to it? And if you have a strategy, yeah,
it is all joined up. And I think sometimes, for those, I've just seen that, that I've been chatting to Phil Chambers on the group chat, and we're both in agreement about people needing to learn lessons about web accessibility. I don't think many people understand the legislation that's been passed. I don't think they know that there's a deadline for us to ensure the websites are going to be fully accessible for people. I also don't think people know where to go to for help, how long that's going to take, how painful it's going to be. And actually it's a very simple process for people to go through. So I would say, don't panic. If you haven't run this already, there's lots of people out there to support. But make sure you're taking a real planned approach as well when you're addressing this, because it's important to get this right now.
That's the key. And absolutely, it's like, I know sometimes in the sector we often talk about being brave and that this will make you feel uncomfortable, whereas actually planning strategy, and also in terms of your organization in intersectional inclusion, what I've found in since DCN and working with your good self, it broadens your outlook in
it
what
really
people
does.
because it's like, people think about museums, what you do really well, what you need to work on, and it just feels like everybody's opened the doors and the windows and let all the fresh air in. So it becomes less about the individual making the changes and more about the organisation.
Absolutely. And I think the other point, so you will all recognise I'm in the chat forum as Becky's speaking. The one thing to also come back to, and I've mentioned it in the chat, is the good practice that you're going to hold yourselves accountable to, whether that's equality, diversity, inclusion, whether that's accessibility, is also making sure that you're holding your third parties accountable as well. Because if you have contractors or suppliers, and that could include web designers and developers, also ensure that they're meeting some of these requirements around guidance and what good looks like when it comes to digital accessibility. So also don't be shy in holding others to account.
Yeah, and if you're not sure, always ask them to. So if you go to a conference and you're interested in a piece of hardware or software, ask them. Always ask them. And they should be adhering to accessibility standards. And if they're not, just walk away. It's absolutely fine to do that, because you're going to need to show why you've picked that particular piece of software, but also in terms of how impactful that could be on your services. So just, if you're not sure, ask. If they say no, walk away. Right, here we are. What we know as well about COVID and the importance of intersectional inclusion. So we've looked at the website. We also know about the legislation. We're going to go a little bit more into digital inclusion as well. Is that we know that people have been shielding. So I don't mind using myself as an example here, but I'm type 1 diabetic and I'm on the shielding list. I am. And the key thing is with that is that for people who are higher risk, diabetes is a day-to-day thing for me. I've had it for 37 years. But now COVID has changed everything in what I do, how I go out, do I go out, what is the risk in respect to that, but also in terms of my family as well. So in terms of intersectional inclusion, it's about thinking about the individual, but also the people around them. their siblings, their husbands, their partners, their kids, parents, all things like that? Do they have carer responsibilities? What is the situation in terms of social and economic status, as we were saying before? We know that the virus risk isn't evenly distributed. So already we've had a few conversations where people have said, do you know what? I really want to have some face-to-face meetings, as we were saying earlier. Do you really want that to happen right now? Is that absolutely necessary? Think about what we've learned during the lockdown in terms of using Zoom, using flexible working. Think about how you can engage with people in different ways. This is where your creative thinkers and your innovators can be extremely valuable to your team, because what you don't want to do is put fear into people to think, do I really want to be involved with these guys if they're going to be talking about this? Where do I sit with this? I don't know if I really want to be going to that organization. Are they really taking it seriously? Those are thoughts and conversations that you have no control over. So clear messaging, emphasize what you're doing very clearly, but also ensure that you are reflective of what you can do and the practicality of delivery in respect to that. Don't think about face-to-face Christmas parties and things like that just yet. It's too early.
I think it's also fair to say, so I, for those who don't know me, I normally travel quite a lot.
Yeah.
Maybe too much, some would say. So I've appreciated not traveling, I've got to say. But one question has just come through, actually, and it's a really important one that Lucy Cook's mentioned from East Riding Museums. And we do encourage you to not have people meeting if it's not necessary. But it is important when people do feel isolated, you know, they're working from home, it's been a long time. I did travel this week and I really appreciated seeing another human being that I'd not seen face to face for quite a while. But it was absolutely a session that needed to happen face to face. Had I been able to do it in an alternative way, I would have done. But because it was about physical built environment audits, I went to site. But I did appreciate that. So for those who want to meet up because they're feeling isolated, I would say do that in a really safe, socially distanced way with a really justified reason to do so is my encouragement. We can't tell you what to do and not do, but certainly make sure that you're doing anything like that really safely.
Yeah, and I think also in regards to that, because I've had similar situation recently where somebody said, would you like to go out for a cup of tea somewhere? And I was like, I don't know if I want to right now because I'm shielding. So one of the things that I did was I said, why don't we tap in using Zoom? I'll have a cup of tea here and we can talk as part of that, like virtually. And it just gave me that sense of I had more of a control, but I wasn't going to be forgotten about like that. And that's kind of what I mean, is that there will be opportunities like picnics, people having picnics, socially distanced conversations. But what if you're going to have a social gathering, just consider, like I say, social distancing. But there may be some people that say, no, I don't want to go at the moment because it means X, Y, and Z. And we'll come on to those different barriers in a second. It's about ensuring that people feel confident and that anxiety is reduced as well. Yeah.
I think it's also confidence in saying no, isn't it?
Exactly. Yeah.
No, thanks,
but no.
I'm not that comfortable just yet.
Yeah.
It's okay to say.
Yeah, and I feel that sometimes it's about that situation as well where you just don't want to be kind of forgotten about and sort of left. And I know that's a really key fear for a lot of people at the moment, is that they're going to be forgotten about. And it's like, no, you're not. So sometimes also say it clearly as well. We recognise that people have underlying health conditions. So we've done this. We are looking and developing inclusive practice within our organisation. Sorted like that. Right. So in terms of the people who want to remain at home for people who are thinking about visiting your organisation, who may have a health condition or a disability, or they have they're partially sighted, they may be blind, they've got they may be deaf or hard of hearing. How accessible and effective is your website and the content? So what we're going to do, these are the common barriers to digital inclusion for visitors. So normally it's accessibility tools. So that's your captions, that's also your alt text, like we were talking about earlier. Also things like your non-inclusive digital language, which can be a really key element. Consider things as well, like there is a limited opportunity to digitally engage with services. So your profile is sort of doing this. So think about how people can engage with you, whether it be a Zoom meetup, an informal event, a talk, or a YouTube channel. You could have lots of fun with this, and it's the best bit about it is the cost is quite minimum. You can do a lot of stuff out there with some really key tools like using your phone. So one that I think has got a really good content and tone is Museum Show Off. Have a look at that. People are doing stuff on their phones. They're doing it particularly well, and then they're loading it up on their channel, and I can send that link round. It's a really good, engaging content. There will also be a lack of ability to book tickets and make donations. So when it comes to those barriers, think about things such as your ISSP, which is Internet Society Service Provider, and that is in relation to how accessible it is for individuals to make payments, and also in terms of donations as well, ticketing, things like that. What services do you do? What information do you have? Is your information presented in a good way, but not on an accessible website? Also, what's the visibility in terms of the precautions that are being taken? So if there's any information, the films are absolutely wonderful at the moment. They're all captioned, as far as I know. We haven't seen any non-captioned ones just yet. But think about other information. How big's the toilet? How many toilets do you have? What's the situation in terms of taps? So if you've got arthritis and you're trying to twist a tap, that's going to cause a problem, but you may not have that problem, but you haven't told people about it. This is where we're coming from with this. With regards to digital as well, it's always things like contrast and background. So light grey text and white background, you see a lot. Also the lack of opportunity to increase the text size. So this is also about people who may have shared, they may have lost or broken their glasses. They may have a problem with lights. There might be the neighbours drilling something outside and they're being distracted. That's where your captions can also really define and work in respect to inclusive practice and away from the particular polarized situation that we sometimes find ourselves in. There's also, though, the big one, I feel this is really important right now, and I really want to share it with you, is the profile of museums at the moment in the country. So the idea about the museum isn't for me. So the impact of well-being on this, and that includes the 13.9 million disabled people in the UK. 53% of that 13.9 million feel lonely. 77% of young disabled people feel lonely, and 18% of learning disabled people feel lonely. So that's from Joe Cox's Commission on Loneliness. So in terms of outreach supports your profile, but also that if you make that inclusive, people will come to you in respect to your delivery, your services, and also in terms of your website. They may want to donate, they may want You may have an opportunity to create personal narratives in respect to your collection. You may be able to increase your audiences. You will also be able to negotiate and navigate this situation in respect to COVID. So in terms of digital inclusion, it's an absolute key element. And this is the situation for the organisation. If you don't do this, there is the idea that inclusion and diversity is not integral to the organisation. There isn't the management or the leadership in buying into inclusion and diversity. And this is all of us. So the idea is, as we get older, as our needs change, if you don't adapt to your audience's needs, they will go somewhere else that does. There's also a limited understanding and awareness. So if you don't say how big your toilets are, how many have you got, things like that, are people really going to come on a chance that it might be right, particularly in light of COVID? So consider what information that you have. Also, that it's culturally exclusive and not intersectional. So if you go to how we used to do things, this is for people with this is for people with that, this is for people with other things. In the end, it becomes more complicated to put together. And also, it's not intersectional. If it's not intersectional, you're only going to be understanding a very small part of your key audiences. This is where the intersectionality can really influence, but also through collaborative working to really influence and increase your audiences. And this is just through small adjustments that are very low cost. It's more of a case of making things action-based and prioritized. In terms of, this is one, museum folks, we've had this for years. I've been in the sector for 23 years, and this is so key to us. There's a lack of capacity in the time and planning. And you know as well as I do, there's never enough time in museums. Well, I've got something to tell you. In that if you do it like this, you'll actually find there's an increased capacity, because you're not having to find things out from scratch. You are actually being able to negotiate what you need to do, but you'll have that solid foundation of which to build your resources, your tool bag of digital tools, to be able to create something without thinking, I've got to have it all done by next week. That was a key learning bit from the lockdown. So many people were saying to their digital colleagues, oh my goodness, we need some content like right now. And you could see all this content literally flushing into social media. But the thing was that a lot of it wasn't accessible. Only 10 museums and organizations had captions for museums from home. So in the end, if you do it the way we're suggesting, collaborate, what's going on around you, what's the situation in respect to your tool bag, strategy and planning. We'll get on to staff just after the comfort break. When it comes down to it, that in itself will also release time and also build on your capacity. It'll also extremely be useful to you if any staff go off, but also in regards to people that need to stay at home and how they can work from home. These are workable solutions. The other key thing is that lenses can be medical and not social. So the idea is, what is wrong with the individual? How does the individual adapt to the organisation? Not how does the organisation adapt to the individual? That was one key thing that Sarah and I learned so much. It's about the organisation saying, how can we help? On the social model of disability and intersectional inclusion. Not, this is for people with this. A diabetic person may need to do a blood test. So what are we going to do? Fine. Like that. It's doable, it's sortable. That is the key thing in all of this, is not to make it medical, but make it the social model. Like that. Right. look. Right, on that note, I'm just checking my times. We will have a 5-minute break now. I believe it's 10:50. I can't see it from my clock from here, but I've got it on my little clock just here. So it's 10:50 now. Everybody grab yourselves a cup of tea. We've got some more goodness to share with you. Alex, do I need to refer back to you, sir?
Yes, so thank you for that. That's perfect timing. If you could, so we've got a 5-minute break. If you could please not leave the session because the session is now locked, and also don't change your settings as well. So I'm going to, yeah, we'll come back at 10:55 and see you all soon. That went very fast.
It did.
Well, I think we're going to make a start again now. So welcome back, everyone, and I'll hand over to Sarah and Becky again.
Everybody got their cups of tea? Because you know, as a sector, we run on tea, coffee and biscuits and cake. So I hope everybody's got their cuppers in hand. Let's just get ourselves sorted. Right, folks. I'm going to go through these bits. So with the information side, this covers a lot of what we've already been talking about. So the idea about managing those expectations and behaviours, what you're going to do, but also what you're not going to accept either from your visitors, and make sure that that is clarity as well. So if somebody decides not to wear a mask, and that's because they don't have a medical condition or follow the situation in respect to guidance, then you need to know how you're going to manage that and what their expectations of the visitors will be. And that can be a really good, friendly, connective approach as well. We also need to think about the development of a range of support, both before, during and after the visit, in terms of digital offers and links to the website. So when it comes to your social media offer, consider how that links back to your website and to your services, so you can keep that momentum going post-visit and also attract more people to what you're doing as well in respect to your profile and your services. And the best, most important thing of all is attracting new visitors by your new delivery in terms of your service provision. So very quickly, things such as live and closed captions, BSL, audio descriptions for your images, using Zoom, using your text-to-speech, are you tablet and mobile enabled? When it comes to people who may be colorblind, think about shape, not just color. So think of Candy Crush in terms of the shape, not the color that you identify. I don't play it, so it's the different elements of that, and also different languages if you need to. Also ensure, like we were saying, link those online services together so people are able to book again, look at the situation in terms of any kind of information coming out. Are you after a particular project in terms of donations and fundraising? Keep that momentum going in terms of your audiences, but also this will help you in respect to identifying potential new audiences, and also in terms of your increasing profile in terms of your service provision as an inclusion and inclusive provider. With travel, Sarah was already saying about the situation in respect to public transport. Public transport is still quite a key area at the moment, and we know that 51% won't use the metro or the underground, 41% won't use a public bus, and 37% won't use an overground train. So in terms of where you are, consider how your audiences get to you, and also in terms of how are they most likely, how could that cause a potential barrier? So if you're in the middle of nowhere and you're not part of a major bus network, it's likely that your visitors are going to rely very heavily on a car. So in regards to that, what can you do in terms of your digital offer for people who cannot afford a car right now or are unable to drive? So it creates a situation of a balance, really, of what you can have, but also in terms of potential barriers to audiences and how you can reflect and address those considerations by a digital offer. Another thing as well is to look at things such as your risk and your health and safety. So with regards to that, you've got a situation in regards to people who may need to lip read. So there are face masks available which have the clear visor for people who need to have that. Also think about if there's any kind of visors that people may experience, they need to be in a place where there's not direct sunlight behind them. Think about the anxiety of timing. So for example, if your event starts at 11 o'clock and you expect people to be there, think about how they're going to navigate the public transport side of things to get to your venue. Is that something, again, that can cause a barrier for engagement and participation? And what can you do to either remove that barrier or counter it for people who don't want to use public transport? Think about your flexibility in respect to this as well. So if you know through local knowledge that there is a particular area that's very, very busy, is there a way around it? Is there an opportunity to collaborate with people in terms of getting people to and from venues if you need to? Is there another situation as well in respect to enabling people to not have to worry about that? So how would you address those situations and that concern? I think as well, with regards to this, ensure that you have on your plans and also in terms of your communication where your pickup points are and how far away the car park is to your venue. So if you've got any kind of ambulance mobility difficulty, if you've got any situation at all where people need to find you and get back to their car, that they can do, but they need to know the distance between the car park and the venue. And if they use a taxi, where's the drop-off point for that taxi as well? Right. How did you find travelling on the other day, Sarah, in terms of your experience? Would you mind sharing that with people?
So I travelled last week and I travelled this week. In fact, I've done it the last 3 weeks. So my first venture out, I decided to drive. Now, my challenges, I have challenges on my right-hand side. So long distance driving for me becomes difficult because my leg is in a fixed position. But I chose to drive the first time to Tyne Weir. I'm on the Wirral, so it's, 6-hour round trip. Probably not the best idea I've ever had. So I won't be doing that long distance travel again. But that was okay. Driving was fine. When I decided last week, I headed up to Scarborough to do an access audit. And this week I've been up to Ayr in Scotland to do an access audit. I found that being able to go to a website and understand how the trains are going to run, what measures they had in place for me to feel that risk had been mitigated where at all possible, and for me to be able to contact somebody if I had any additional queries, I found reassuring. So my experience the last 2 weeks has been, is it something I would personally do all the time right now? No. But because I needed to travel, I felt it was well organised. There was information available to support me in planning my journey. And there were people available literally everywhere I looked. There was somebody available to support. So for those who are not familiar with Scarborough, it's a seaside coastal town. Again, about 3 hours away. My geography is terrible, so I can't tell you where on the side of the country. It's about 3 hours away from me, but it's a seaside coastal town. Lovely place for those who have never been. And Ayr in Scotland is also a pretty nice place to visit. East of York, thanks, Peter. Scarborough is east of York. Yes, so don't come to me for geography consultancy because I'm going to fail miserably. But I felt that because particularly Glasgow Central Station was amazing, they were really well organised. I think when you do your research, do your homework, and you plan your journey and you have sight of the measures that have been taken, I felt it was more comfortable. What you're never going to be able to account for is other individuals who are not prepared to wear a mask or don't. I've seen, you know, somebody mentioned there was somebody who refused to do track and trace. We can't, sorry, just noticed someone said Scotland is to the north. Thank you. I know that. So you can't account for people refusing. I think our focus has to be on, in order for us to ensure the health and safety of the people that are coming to the location, what processes, what practices do we have in place? Are we ensuring that we're mitigating health and safety risks where at all possible without having a huge negative effect on the visitor experience, the visitor journey? So I think that has to be the priority. That's what we have to consider. And if people are not doing track and trace, or they're not able to share an exemption mask wearing card, we have to allow for that within our processes and practices. But there will be difficult conversations, and it's going to be a moment where we choose to educate rather than judge a situation for somebody who's refusing to do something. We have to take those moments to educate, is my personal style. I know Becky adopts the same approach, but always bring it back down to your process and your policy. What is it we're trying to achieve and why?
That's the key thing. And I feel that when I was front of house way back in 1999, it was a situation for which we always called it the softly approach. This is why you don't do it like that. And that in itself can also support front of house, but also in terms of risk as well. Right, so they've arrived. You've arrived. Nice rug in the middle there. The key thing is that this is also the bottom line of all of this is in regards to safety and managing risk. So think about things like your toilets, your face masks situation. What is the provision in terms of food and drink? Is there going to be takeaways? Is there going to be any opportunities to refill water bottles? What is the situation in terms of your signage? How frequent is it, particularly for people who may need to use hand sanitizer, and also in terms of the toilets? Another thing as well, and this is something very precious to Sarah, is somebody needs to clean the hand sanitizer pumps as well. Yes, I've seen that. I've seen people do this, next one do this. You know, that's no good. Make sure somebody's there to clean the hand sanitizer pumps. This is it. Interactives. Now, the key thing is with this, in particular with interactives, I've also heard people say to me, look, we're going to withdraw this because it's hard surface. And I said to them, well, you need to explore an alternative. Think about what you could do differently. Frequency of cleaning it goes without saying. And also in terms of tickets and queuing, do people have to queue? Is there a situation for which they can just turn up and off they go? There is also a tool called Neatbox that you can get, which is an online app service, which a disabled person or a family person with neurodiversity can actually tap in ahead to say that they are arriving. And it means that front of house can support these people as we go around. And also in terms of supporting them in respect to information as well. So in terms of the diversity, which is disability and intersectional inclusion, and the diversity of neurodiversity, it would be worth your while looking at Neatbox as a potential tool for entry and supporting disabled and neurodivergent people around your museum and heritage organisation.
An important point, Becky, because on the signage in particular, so to give you an example, the audits I've been doing the last 3 weeks have included built environment, so access audits. And the visitor locations I've been going to typically have been shopping centres, to be fair, really large shopping centres. So signage, similar to a museum or a visitor attraction, is going to have signage on the floor, as well as the walls and totems and whatever the case may be. Also consider what that's going to feel like to people that may have vision impairment. So going around the shopping centres, there were lots of really great directional signs, the one-way routes to keep 2 meters for social distancing, how to get to a car park, but everything underfoot wasn't tactile. But there were no other alternatives to support somebody who wouldn't be able to see or recognise, absorb the information in the signage. So we'll also consider, when you're thinking about your signage, multiple sensory ways in which people need to take in the information. So that's definitely something that I've experienced over the last few weeks, where we're not quite considering all of the people that we need to ensure are feeling that accessible experience.
Absolutely. I really feel that there's been a trick missed in terms of the actual flooring labels and making something that's more tactile underfoot in respect to this, to support particularly blind and partially sighted people, but also in terms of recognizing that people will not necessarily, they will have other people with them, such as a carer or assistants, things like that. So it's worth also bearing that in mind as well. So these are some really key things, and this is in our guidance as well. So for hard surfaces, touching contaminated surfaces can be present 3 days on hard surfaces. Also, dressing up costume shouldn't be reused. It needs to be housed away in respect to, reused in a 72-hour window. There's got to be separate rooms may be required to house used and safe costumes. Are they also washable as well? That's another key thing. We know that toilets, that there is transmission of COVID through feces and aerosol via urine. So it is a route of infection. So ensure that your signage says, close the lid before you flush. There have been case studies in relation to this. Make sure that it's in different languages. If you need to, close the lid before you flush. Think about your touch points for things like your handrails. Think about where people lean, things like that. That in itself is a touch point. Handrails are very important to me because I've got dyspraxia, which is gross motor coordination. I have to use a handrail in order to descend a flight of stairs. So think about your handrails, and also in terms of any lean points, anywhere that people might put their hands. And then also check your air conditioning units as well. Just go to your provider and have a chat with them about that in respect to COVID. Got some recommendations. Think about a buddy system for people who are partially sighted or blind in terms of supporting their confidence. Also, like we were saying earlier, think about your plexiglass. If it's in bright sunlight behind you, people will find it difficult to lip read. Think about your frequency and clarity of your signage for people who need the toilet quickly. Think about your alternative formats in terms of information and signage. So your braille, your embossed. Make sure if your embossed signage is on the toilet door, that is part of your cleaning program. And think about your visual imagery, because that in itself can support so many audiences. I've worked with adults who have difficulty with literacy. And the key thing is with that, if it's visual, it's worth 1,000 words, but it's got to be clarity and it's got to be meaningful as well. And of course, ensure that there's cleaning and hand washing throughout with the appropriate signage at the appropriate height with potential support if required. Right. But I know in museums, we talk a lot about our collections and the country's collections and heritage. But there's also another valuable asset, and that's us, our staff and our volunteers, who are critical in the services of our provision and also in terms of our delivery. The key thing is with all of this is, as we were saying, the safety is paramount for everyone, but also that you need to have a transparency in terms of your policies and procedures. You need to think about your staff as a unit of people who will have different needs. Now, we are in a very competitive sector, and so people will not necessarily feel comfortable in talking about their needs, where it be an illness that they have, or they may have, their parents might be poorly, they may have an ambulant mobility issue. They may not want to talk to you about that because of fear when it comes to redundancy, but also in terms of what you're going to do with that information. So EMBED and DCN had a conversation about this, and we have a passport system to support employers and employees in regards to this situation, and we'll just come on to that in a sec. But also, we've got to think about the role of the leadership and the role of the front of house staff. And that basically, though you've got the leadership who is in charge and in terms of responsible in terms of legislation, your front of house are going to be critical in how you adapt your changing services and your support for your audiences. Can see some people almost punching the air on that one. So this is how it works. So in terms of the role of the leadership, you've got the leadership at the top, and then you've got your employees. The key thing is with all of this is that in terms of experiences and information, that information needs to go to the top up and the bottom down. And inclusive practice is for everybody in the entire organisation. It's not just for the learning team or for the particular sort of department or particularly for front of house. It is everybody. Absolutely critical that it's everybody. Your staff are going to be important in how your visitor is supported. So I'll just come on to that. So in terms of this, just have a quick look at my notes. Yes. So your staff are important in how your visitor is supported, and the feedback, key feedback on actions and tasks and communications within the day-to-day experience. There's got to be clear, transparent structures, so people can share concerns in a safe space without fear of reprisal or potential risk when it comes to redundancy or any restructure. You also might want to consider as well any kind of policies if people live on their own. So if they do get the virus, God forbid, what do you have as an employer to look after your staff to enable that they feel that there is something there if they should catch it? Can people leave food out for them? Do people touch base with them if they need to self-isolate, so they don't feel like they're being withdrawn from the actual organisation itself? What are the connections and the collaboration opportunities through the local authority and nearby groups to support employees as well? So things like Wi-Fi access and things like that. Where are they based? Is there anything in the works in respect to this, particularly in regards to speed of broadband, Zoom, things like that? And also that EMBED's just recently developed and delivered a podcast with captions in regards to being an ally for people who may not necessarily be part of your group, so to speak. And that's a key thing to listen to, because sometimes it's very difficult to see things from other people's point of view, or you don't feel confident in being able to do that. So I would say it's worth your while listening to that podcast and how you can stand by colleagues on their specific needs, and particularly in respect to making this less about the individual and more about the organisational commitment. With regards to the changing needs of the staff and volunteers, make sure that you keep in touch, as I know a lot of people have been doing, but also consider how they would stand in respect to further volunteering with you at this current time. Consider, wasn't it the other day, Sarah, where we were talking to somebody about having an informal get together, and they were doing some amazing research, and they were going to get their volunteers together as a kind of little informal meetup type of yeah.
It was a digital coaching session.
Yeah, that's it.
Was it the Jewish History Association?
That's right.
Who were going to use their volunteers to get involved in some of the changes that they wanted to make and some of the additions they wanted to make to the service. And that also included how they could improve their digital engagement for visitors and the research that was going to sit behind it, and how they could leverage and push all of that through into what, you know, visitors can see. So yeah, I think it was the Jewish History Association.
Yeah, because that was the thing, because where I used to work before I did DCN full time, we used to have these like informal volunteer lunches. Well, you could still have one, but have it via Zoom, like that, or have like something for people to read in respect to an article that they can send via the post, or you've got also collaborative opportunities with people like Age UK in respect to digital skills. And also, like I was saying, there's a lot of collaboration at the moment on real Pacific social inequalities. So DCN's part of We Shall Not Be Removed. And also we were part of a webinar just recently on digital exclusion, where they're actually looking at different action-based solutions to actually put in right now to pick this up and literally support it as we navigate through this, but also at the same time bringing on to various leadership, policymakers, government in respect to what the future needs to look like. And I feel that's absolutely critical right now. Another thing that we're looking at as well is, as our needs change, whether it be permanent and temporary, we also need to think about how this can influence positively the user experience. And I feel that's absolutely critical. So if you have a workforce that has a range and recognition of changing needs, that positively influences the user experience. And that literally is what we're seeing in everything that we're doing right now, that the end user is influenced by the workforce and the workforce is influenced by the user. And if you have that conversation, which involves everyone in that organization, you will find that you've got probably a front of house staff member who's got that one idea, that critical, innovative idea that would support the users through enabling the adaptation of an existing offer. And that needs to be heard by the leadership who have got the budget. So it's about creating those clear communication structures, because they in turn positively influence the user experience. Another thing is that with engagement with colleagues, this can be done through a variety of methods. So we're going to very quickly go on to these. One of them is staff networks. Staff networks are actually, I've got on my screen at the moment, Sarah is, I don't know how I can describe you in respect to network. Oh. My goodness, it's like, she's an expert, folks. So when it comes to networks and setting up networks or access champion schemes, we can help you with that. And that's not a shameless plug, well it is, but it's one of those situations which you don't reinvent the wheel. Talk to somebody who's done this, been there, done that, has chaired and developed their own network, which is Sarah here, and how we can support you with that, because it's low risk and we can share that learning and knowledge with you. What do you think, Sarah?
I think staff networks and employee resource groups or staff forums, whatever we want to call them, when we tap into I would say our greatest asset is our people. When we tap into that, they become a real vehicle for change, because when you set up those networks, you have volunteers come forward that have a natural a natural affinity with the conversation, they have direct lived experience, they may be an ally, they may be a carer, there'll be a connection to why they want to get involved, and they naturally want to help bring about change. So when I have set those up, when I've been a part of them, when I've coached and guided them, when you allow and support them to become an action orientated network or group, they're really amazing vehicles for change, because they're the lived experience, right? They're able to tell you what it feels like. And has anyone developed induction packs of staff and volunteers is one of the questions. We could pick that up offline, but yes, we've absolutely done that. I think your networks are also, if you have any of those in place, will also be really supportive in creating that type of collateral, because it makes sure you're playing into everything that everyone would want to know, should they be an employee. So great tool. Yeah, great tool.
What I would say is that how museums have developed networks is a very slightly different model to how organisations develop networks. So within the ones that I've seen, within that's how Sarah and I met, it's very much about the organisation and supporting employees within the organisation. It supports the organisation through various user experiences and pathways. In museums, what we have is networks that want to change policy, and they're slightly different. So this would be about how a network could support you through your staff members and your employees, supporting that clear structure and that transparency, and then leading towards that better experience for the user, like that. So it's just the current ones that we've got at the moment are very slightly different to that overall offer. Right, passports, podcast on passports. This is a very important tool that supports colleagues and volunteers at all levels in respect to inclusive working practice and also the intersectionally inclusive workforce. It will help people at all levels, and it's not a tool for which is predominantly for people who have a disability or neurodivergent profile. It's for everybody. And that's really important, because it can be anything from supporting a parent who needs to pick up their child at 3 o'clock, who may be a single parent. There may be people with carer responsibilities due to their parents. There may be a situation for which it needs to be a hospital appointment. There may be a situation for which a partner needs to support their other half in respect to COVID at the moment. This will help you plan. This will help you create a strategy and ensure that reasonable adjustments are supported, because reasonable adjustments are often to the individual, so they're not a cookie cutter scenario. But also, most importantly, it can give you an idea on who may need to stay at home a little longer, flexible working, what we've learned from the lockdown, and also the situation in respect to things like our emergency planning that we have for accreditation. So if your museum starts to flood, God forbid, you will have the information via the passport on who's going to be viable and who can do the role of getting the stuff out, who are the people that need to be packing the stuff, and that could be based on changing needs of your staff, so they don't have to self-advocate. It gives you guys confidence, and also it gives your employee and your volunteers confidence. I can't rate these enough. We desperately need them within the heritage sector, and I feel that what we've done is we've actually created some support for that, haven't we, Sarah, in respect to the passport schemes?
Yeah, there's so I've used these over the years, and the lady that originally created this 10 years ago maybe, as a wonderful lady called Sally Ward, originally came from BT. Her and I decided to create an embed version free of charge, because these are available but you've got to pay for them. So given where we are right now, these are such a useful tool for helping to remove some of the fear around difficult conversations as well when it comes to any of our adjustment needs within the workplace. So yeah, this is free of charge. Please do get in touch If you, in fact, go to the website and you'll be able to access the free download.
I can't rate them enough, and I know of people that use them, and it's just seamless. It's just you see all that anxiety go, and the best bit is it's brilliant for your profile as well. Go and
these
work for
don't
them.
have to be really complicated systems.
No,
the one we're offering is a really simple paper-based tool that's going to aid those conversations. So please go to the website and download.
Right, I think that is everything. I've realised that we've just about hit 11:30 and Alex has just appeared. Does anybody have any questions at this point? I think we've got time for a couple, but I think what we're also going to do is glean the questions as well, so we can get back to you as well if you've got anything that you'd like to raise with us.
Yeah, I was just thinking, Becky, if we've missed anything in the chat, we can follow up with emails after the session.
Yeah, absolutely. Sorted.
Brilliant. Well, thank you. Massive thank you to you and Sarah for delivering today's session. It's been great. It's been really insightful. I hope people have taken a lot from it, and it's been really good to see so much chat going on in the chat function as well today. Massive thank you as well to museum development teams in Yorkshire and the North East, and for giving us support on the chat this morning. That's been brilliant. And also thank you for helping us with the sessions that we've been running over the last month. So I think we've run 5 workshops together over the last month, and it's they've all been about reopening. So we hope you found them all useful, and we will share the recordings that we've made of this session and those other sessions as well after today. So don't worry if you've missed anything, because you'll be able to catch up during watching the recording. And lastly, thank you to you all for attending and participating so much in the chat. It's been, I've thoroughly enjoyed it. So is there anything else that you or Sarah want to say at all?
I'm absolutely fine. I'm just looking through the chat at the moment. This is brilliant. Absolutely fantastic. Yeah, but do get in touch.
Yeah, do get in touch. I just want to say a big thanks, actually, because the amount of collaboration and sharing, lessons learned going on in the chat function is absolutely what EMBED is all about. It's about getting our brains together and seeing how we can help each other. So that's been fantastic. And there's some really great ideas that I do encourage people to follow up on, where they're referencing really brilliant resources that are out there. So yeah, thanks ever so much. Thanks for the collaboration, and please do get in touch if we can help.
And I must also say thank you to Joanne for providing the closed captions today. They've been brilliant. So yeah, that's it from us, and I'll speak to you all soon. Take care.